This medication, Hizentra Vial, is used to strengthen the body's natural defense system against infection in people with a weakened immune system, also known as primary immune deficiency. It contains natural substances called antibodies, specifically IgG, which are derived from healthy human blood, plasma. These antibodies support the body in fighting off infections and help to combat an infection if you become ill. In some cases, Hizentra Vial may also be used to treat a specific nerve disorder called chronic inflammatory demyelinating polyneuropathy, CIDP. It is important to follow the recommended daily dosage and to take Hizentra Vial at the optimal times as advised by your healthcare provider for the best results. Before using Hizentra Vial, make sure to read the patient information leaflet and instructions for use provided by your pharmacist. This medication is given slowly by injection under the skin as directed by your doctor. The dosage and frequency of the medication will depend on your medical condition, weight, and response to treatment. If you are administering the medication yourself, it's important to learn all the preparation and usage instructions from your healthcare professional and the product directions. Do not inject this medication into a blood vessel, and make sure to store and discard needles and medical supplies safely. When using Hizentra Vial, do not shake the medication and check for any particles or discoloration before use. Change the location of the injection site with each dose to avoid problem areas under the skin, and the recommended sites for injection are the abdomen, thighs, upper arms, and hips. If you are receiving immune globulin for the first time, or if you have switched from another brand, it is recommended to receive the first dose in the doctor's office or clinic to monitor for any potential side effects. It's important to use this medication regularly to get the most benefit from it. Mark your calendar with a reminder of which days you should receive the medication to help you remember. Some mild side effects may occur at the injection site, such as swelling, redness, or itching. These symptoms usually improve as your body gets used to the medication. You may also experience headache, upset stomach, fever, nausea, diarrhea, sore throat, cough, or pain. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefit to you is greater than the risk of potential side effects. Most people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects, such as signs of kidney problems, sudden weight gain, or a fast heartbeat. Seek medical help right away if you have very serious side effects, including severe headache, stiff neck, eye pain, sensitivity to light, or trouble breathing. While it is rare, a very serious allergic reaction to this drug is possible. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. In the US, you can call your doctor for medical advice about side effects or report side effects to the FDA. In Canada, you can call your doctor for medical advice about side effects or report them to Health Canada. It's important to be aware that Hizentra Vial may rarely cause serious blood clots. You may be at a higher risk for blood clots if you are an older adult, severely dehydrated, have a catheter close to your heart, or have a history of blood clots, heart disease, or stroke. If you are immobile or use estrogen-containing products, you may also have an increased risk. It's important to discuss these risks with your doctor or pharmacist before using this medication. To decrease the risk of blood clots, the medication can be infused more slowly or a less concentrated form can be used if available. Staying properly hydrated before receiving this medication may also help reduce the risk. If you experience any of these symptoms, seek medical help right away: shortness of breath, chest or left arm pain, unusual sweating, dizziness, fainting, pain or swelling in the arm or leg, severe headache, trouble speaking, weakness on one side of the body, sudden vision changes, or confusion. Before using Hizentra Vial, make sure to let your doctor or pharmacist know if you have any allergies or if you have a medical history of certain immune system problems, kidney disease, diabetes, current blood infection, or severe dehydration. Some immune globulin products contain maltose, which can cause false high blood sugar levels, so if you have diabetes, check with your pharmacist about this. Also, Be sure to inform your doctor of any recent or planned immunizations/vaccinations, as this medication may prevent a good response to certain live viral vaccines. Since this medication is made from human blood, there is an extremely small chance that you may get infections from it, so consult your doctor or pharmacist for more information. Before having surgery or dental work, be sure to let your healthcare providers know about all the products you use. If you are pregnant, use this medication only when clearly needed and discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential interactions with other medications, as they could affect how Hizentra vial works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medication without consulting your doctor first. It's also worth noting that this medication may interfere with certain tests, such as blood sugar tests and blood type tests, potentially leading to false results and serious consequences. Be sure to inform all lab personnel, doctors, and pharmacists about your use of this medication and the type of blood sugar testing strips you use. This will help ensure accurate test results and prevent any potential risks. If someone has overdosed on Hizentra vial and has serious symptoms such as passing out or trouble breathing, they should call 911 immediately. Otherwise, they should contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. It's important not to share Hizentra vial with others. Your doctor may also perform lab tests to monitor your progress, such as IgG levels and complete blood count. It's best to consult your doctor for more details on the frequency of these tests. Remember to take each dose of Hizentra vial as prescribed by your doctor. If you happen to miss a dose, make sure to consult with your doctor or pharmacist to determine the best course of action for your new dosing schedule. It's important not to take a double dose to make up for any missed doses. Always follow your doctor's instructions closely to get the most benefit from this medication. When it comes to storing Hizentra vial, it's important to follow the specific instructions for the brand you have or ask your pharmacist for guidance. Once you open a vial, make sure to discard any unused portion immediately and do not freeze it. Always keep medications out of reach of children and pets. When it's time to get rid of Hizentra vial, don't flush it down the toilet or pour it into a drain unless you're told to do so. Instead, properly dispose of the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.